Today I'm going to talk about respiratory diseases in Ramadan. Okay, most patients who have chronic respiratory diseases, especially asthma, COPD, and other chronic diseases, they are hesitated and they have conflict whether they can take inhalers and their treatment during fasting. I'm going to answer about these questions very briefly. We all know that these patients use these inhalers, and these inhalers are supposed to be taken through mouth, but some particles can go and cross inside throat, and they go down, swallow inside the stomach, so they will break their fasting. So most of them, they are reluctant, they are hesitated whether they should fast or not. There is two categories of patients. The first category, asthma patients, COPD patients who are very sick. They have too much cough, they have too much wheezing, and they are sick enough, and they have to take these relievers over 24 hours, and some of them may need to take nebulization, and this nebulization machine will produce some steam, and this steam will go inside the throat like fluid inside the stomach, and this will break fasting. These patients really should not be fasting. The other category, the asthma patients, COPD patients who are stable. We mean by stable, controlled, that they don't have severe symptoms. They are stable. All what they have to take is their inhalers. In this situation, they can just divide the doses of the inhalers, starting iftar until suhoor, and they could still be fasting and control over their asthma. Okay? Now the final decision, whether the patient can go fasting or not, is an issue that should be discussed with the doctor and the patient. But the patient has to know and realize that our priority is to preserve his health. I have another issue which is very useful in COPD patients, chronic obstructive pulmonary disease. These patients and also asthma patients, they know themselves that they smoke. And during Ramadan, during fasting hours, they refrain from smoking. And most of the COPD patients, asthma patients, after Ramadan, they come and they say, we felt like we are okay during Ramadan. So I hope these patients during fasting hours, they refrain from smoking, but they should not smoke after iftar like they want to compensate. Okay? So the advice for these patients, the stable patients, is to refrain and stop smoking during Ramadan, and to catch this chance like this month to have it an advantage for them, maybe to stop smoking forever.